Hi, this is Mariah Smith, and this is activity 6 for KH3500. In this video, we will be doing the entire exercise, corrective exercise continuum for poor ankle mobility. We're going to be starting off with inhibitory techniques, and with inhibitory techniques, we had to choose an overactive muscle, and I've chosen the soleus. And to decrease the overactivity in the soleus, I will be using self-myofascial release with a softball. You can use any tool. I choose a softball because it's hard and it gets deep into the tissue. And with self-myofascial release, we will be decreasing the overactivity in the neuromyofascial tissues. And essentially, the external pressure stimulates receptors located throughout the muscle, fascia, and connective tissues. And with the external pressure to the soleus, there happens to be autonomic inhibition, which is basically the external pressure produces a relaxation response by the muscle. To properly roll the soleus, you want to make sure you're properly aligned, and you want to make sure you're relaxed, and you want to slowly move up or down the muscle. Make sure you're relaxed, and when you find a trigger point, you want to stop and hold. I just found a trigger point, so I'm going to stop and hold for at least 30 seconds. And after the 30 seconds to 90 seconds is up, you want to slowly move away from the trigger point. And if you find another trigger point, you repeat the same process. So now we're going to move on to lengthening techniques, and we're going to stick with the overactive soleus muscle to lengthen it. And we're going to be doing static stretching and we are doing static stretching because static stretching is a flexibility technique used to elongate the shorter neuromyofascial tissues. It mechanically elongates the tissue and neurally produces an inhibitory response. So in this demonstration, I will be stretching the right soleus. So we are going to have the right leg straight and then the left leg slightly bent. Our hands are going to be straight. And we are going to simply force our heel down as far as it can go. And this is going to be stretching the soleus. You want to hold it for 15 to 30 seconds. And then switch to the other side. So now we're going to be moving on to activation techniques. And we're going to move away from the overactive muscles and focus on the underactive muscles. I will be working on the medial gastrocnemius for the underactive muscle, and for activation we are going to be using positional isometrics. And positional isometrics is basically what we're going to be using to increase the activity of the underactive muscle. So we're going to do plantar flexion on the wall for our positional isometrics. So we're going to have our feet flat on the wall. Make sure your back is straight. And if you have tightness in your hamstring, you may want to put your arms and help that release pressure and tension. And then we're going to do 4 reps for a 4-second isometric holds at 25%, 50%, 75%, and 100%. And after each rep, we're going to have a 2-second rest in between. So this is 25% right now. 1, 2, 3, 4, 5. 70, 20, 50. 75. And 100. So now after activation, we're going to move on to integration, which incorporates the entire human movement system by increasing multiplanar neuromuscular control. And with this integration, we're going to be incorporating not only the muscles that we inhibited, lengthened, and activated. So that we're not just going to be using the soleus and the gastrocnemius, we're also going to be including other muscles such as the quads and the hamstrings, and we're also going to move into the upper body, and we're going to use our abdominals, our erector spinae, obliques, latissimus dorsi. So we are definitely incorporating the entire movement system to perform this exercise. So again, for integration, we are going to be doing step-ups, You can do it with an extra load, or you can just do it with your body. And I'm doing the chair for the step-ups. Usually you may want to have it a little higher, but I'm having knee problems, so I'm not going to put too much stress on my knee. And to do the step-ups, make sure that it is systematic and controlled, and you want to do a few reps, 10 to 15 2-second holds at the top. And what we're going to do is we're going to flex the hip, knee, and make sure the foot is dorsiflexed. And step up. And do it again on the other side. And continue.